Welcome to CityWise. I'm your host, Tiana Stevens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best. Well, for 2 decades, a Rochester organization has been hard at work, dedicated to the care of our most vulnerable community members. Healthy Baby Network strives to give every baby the opportunity to be born healthy by supporting moms and families. Joining us today is Deanna Spiata. She's the office manager at Healthy Baby Network, and Yolanda Sayers is an outreach coordinator. Thanks for coming on today.
Thank you for having us.
What is the Healthy Baby Network exactly?
So the Healthy Baby Network is an agency that has been around for the last 20 years. Really, and our mission is to ensure that every woman in the city of Rochester has a healthy start with their baby, and that their baby is born on time, born at over 5 pounds, and that if there are any services that the mom may feel that they're in need of, that they get those services, as well as breaking barriers to structural racism. We want to make sure that everyone, when they walk into a doctor's office, feels the same, comes out the same, getting the same services. And so our mission in partnership with a lot of agencies around the community really helps pushes that idea that we have at the agency.
Okay, and Deanna, what are some of the services that accomplish all these goals that you offer?
We accomplish those goals through outreach, education, and helping people get access to care.
Okay.
So our outreach team, which Yolanda heads, meets women on the street right where they are and around the city of Rochester, and helps them get connected to health insurance, and not just women, but everyone surrounding mom, because we want to make sure that everyone who surrounds mom helps her to have the healthiest pregnancy that she can have. So we help people get access to health insurance and access to support services like case management and making sure that they're going to their doctor's office visits.
Yolanda, what is the reaction from moms or those surrounding moms when you say, hey, we want to connect you to all these services? What's the community reaction?
Well, because the target population has such a high need and it's a high-risk population that we're interacting with, we don't really have anyone standoffish and saying, oh, I'm okay, because that's the target that we're going for. And what's unique about our outreach team is that we are walking the streets in targeted neighborhoods. We're not telling people, come to us, we can provide this for you, but actually foot soldiers walking the street. And the team, along with volunteers from different agencies, come out and they're able to speak more to the programs that these moms are going to be involved in. We are very received out in the community. You get your women that are like, oh, I'm okay, but for the most part, because we have to capture pertinent information in such a small window, name, address, phone number, and what their the services are that they're in need of, that the compassion and the empathy that our outreach team shows the individual, we're able to capture that information. So we're very receptive out in the community.
Wonderful. What happens when a mom comes into the office? What's the first thing that happens?
Well, we don't provide direct service from our office, but our outreach team provides referrals to other services in the area that we call them our partners we've partnered with in our community.
Who are some of those partners?
Unity Healthy Moms program through Rochester Regional Health System, and trying to think of some others. Baby Love
through the University of Rochester Nurse Family Partnership, Early Head Start ABC, Mothers in Need of Others. We've partnered with WIC, allowing us to go sit in their waiting room to recruit moms, as well as moms that are not connected to services as well. Healthy Start Center, Rochester Regional, North Clinton Family Center, and just a variety of agencies that we're partnered with. We can't do the work alone. So.
Sure. Do you find that moms are in need of certain services more than others?
They are. We realize that Rochester is, the poverty level is a little bit higher than we would like, and a lot of our moms are at a disadvantage because they are receiving so many different services. And so really just trying to make day-to-day work for them, such as trying to stretch this dollar and making it work within your household when you're only getting a limited amount, that they're in need of just basic food for the family, just support services and mental health services as well, because they're dealing with so much. They're dealing with day-to-day things that are just piling up on top of mom. And so really getting them into mental health services, we're finding that that's becoming a little bit more of a trend.
Right. And do you follow the mom after birth and connect her? You know, many other services are needed after the baby's born, of course. What happens after baby's born?
Well, the great thing when we're referring them to the home visiting perinatal services such as Baby Love and Nurse Family Partnership, they're following mom all during pregnancy if they're getting into care early as like the first month. But if we meet them a little bit after, say like the 7th month of pregnancy, they're following them up until 1 year postpartum, and some of the program is 2 years. And so it's really getting mom when she's knowing that when she's pregnant and up to 2 years old. Through that whole entire time, we know that you're going to have lots of questions, and the transition from me being pregnant and now I have this whole human being, what do I do with them, to ensure that mom and baby are taken care of.
And speaking of planning ahead, you guys have been really busy planning a wonderful new event, Countdown to Kindergarten. Can you tell us about that?
Yes, this event was an idea of our executive directors, Lauren Deutsch, and she was reflecting on some data from 2010 on the infant mortality rate in Monroe County, and 59 babies died before their first birthday in 2010. And she was thinking about how now those babies would fill almost 2 kindergarten classrooms. And so we were thinking, how can we help the community learn how we can help every baby born in 2016 make it to kindergarten in the fall of 2021?
Okay.
So this event is meant to help families, moms, and kids understand how to live healthy so that we can make sure that every baby thrives.
Okay. So what will happen at this event, and when and where?
It's on September 17th. It's a Saturday from 3 to 6 p.m. at the Ryan Center on Webster Avenue. And we're going to have different agencies and companies that are going to have tables there with resources on different services and healthy living. And then there'll also be some family activities like face painting. We're having a juggler there and onesie decorating. And we're also going to have music there, so it'll be fun for the whole
and the
family.
Street outreach team will be there?
Yes, the outreach team will be there. And what we're doing right now is sending out invites, for different agencies if they would like to come and table with us.
Okay.
They will definitely get in contact with Deanna, and our outreach never stops.
Okay. Tell us about your team, your whole team. There's 8 people in the office, all women.
Yep, so we have our executive director, and then we have 2 grant project directors, one over our state grant, which is we call it the Mitch grant. It's the Maternal Infant Childhood Health Collaborative, and the Healthy Start grant, which is a federal grant. And then we have 3 outreach workers on our outreach team, and a health educator, and me.
Okay, so along with grants, how else is Healthy Baby Network funded, and can the community help out?
Definitely. We are funded through state and federal grants, and then we're also funded through any donations that come our way.
Okay. What are some of the success stories that you guys can share about moms that you've encountered and worked with throughout the years?
Well, from outreach perspective, we've had moms that we've met on the street, really, and one was actually enrolled in the University of Rochester, came in from New York City and was homeless. And we were able to get her into a shelter, enrolled in the University of Rochester, finding grants for her for books, and having her actually meet her prenatal appointments without missing one. And her daughter was born on the autistic spectrum. So it's like, now what? I'm in school, I'm 20 years old, and I have a daughter who's on the autistic spectrum. Really finding assistance for her and being a support system for her, getting her with Baby Love program, and ensuring that she graduates, and she did graduate. And then moms helping them navigate the system. We have moms that are having problems with our Department of Human Services for whatever the reasons are, and then really making sure, okay, we're sitting you down and they ask for this particular paperwork, and getting them that paperwork so that where their services aren't cut. And really, if mom is having a problem with the landlord, referring them to the Rochester Housing Council to ensure that, hey, we know you're not going to get evicted, but you have to do your part. And really having a positive outcome out of every interaction that that we encounter.
Mm-hmm. And community partnership is kind of a theme that I'm hearing here,
Yes.
and connections. And you mentioned Baby Love a few times. Tell us a little bit more about that organization.
Well, Baby Love is a partnership through the University of Rochester. It's an evidence-based program where there are community health workers and there are social workers as well that actually go into the homes of mom. They visit mom. Sometimes it's about a month, one time a month, and then it's more frequently when mom is getting ready to give birth. Mm-hmm. But really being in there, being hands-on with mom, and any questions that mom may have regarding her pregnancy, regarding birth, they're there to help provide those questions, as well as providing transportation, because that's another barrier that I'm not, Rochester, we get cold winters here. Yes. And if mom already has children, getting on the bus with those children as well can be time-consuming. Mm-hmm. And not only that, we're talking about taking 2 buses just to get to an appointment. Mm-hmm. How can we help alleviate that barrier? Putting mom in a car with a Baby Love community health worker, getting her to the appointment, and then if there was something in the appointment that she didn't understand, the Baby Love worker is there to advocate for mom and really mm-hmm. inform her, okay, this is what was said and this is what you're supposed to do.
Mm-hmm. Wonderful. Finally, what keeps you motivated to do this great work?
Definitely our moms and babies. Mm-hmm. I work in the office a lot, so I am not always on the front lines, but I try to remember that we're all an arm and we all do it together, a branch of the whole staff, and I just try to keep in mind our community and how we can make it better.
Wonderful. Thank you so much for coming on today. Healthy Baby Network is located at 693 East Avenue in Suite 200. That's in Rochester. For more information on program services and to get referrals, visit their website, healthy-baby.net, or give them a call at 585-546-4930.